Hi there, this is Dr. Cruz, MD from Kentuckiana Integrative Medicine, and we're going to be talking a little bit about IV chelation and IV plaque X. IV chelation has been used to help patients with heart disease and peripheral artery disease like claudication, so poor blood flow to the legs, and also poor blood flow to the brain. When your carotids in your neck, the carotid arteries are partially obstructed, often smaller blood vessels in your brain have poor blood flow, and chelation can help open those up. So IV chelation comes in two primary forms: IV sodium EDTA and IV calcium EDTA. In this country, those clinics that use chelation primarily use IV sodium EDTA because it has the greatest number of studies in demonstrating that it helps with blood flow to improving blood flow to the arteries of the heart and the rest of the body, including brain, legs, arms. And the way chelation works, it was described as quote, a roto-rooter to the arteries, and that's a mistaken concept. It improves circulation by reducing oxidative stress and removing heavy metals from the body. And many of us accumulate heavy metals like arsenic, lead, mercury, cadmium through life. And there are certain professions that have a much higher incidence of having a heavy metal burden, like farmers with the use of their pesticides, dentists, dental hygienists, people who work in factories with exposure to weapons or chemicals, painters are at high risk for having elevated heavy metals in their body. And it's very easy to check for heavy metals in the body. We like in integrative medicine to do a urine metals challenge test where we give you 4 chelation pills and you take those in the morning on a day that you're not busy, and then you'll urinate and flush, and after that you collect your urine for 6 hours and send that into a lab that will tell us if you have a heavy metal problem. Now, urine metals testing is not approved by insurance companies or conventional medicine, but it is a very useful tool if you know how to interpret that kind of testing, and just like hair analysis. Blood metals testing is very insensitive. By the time you have heavy metal levels showing in your blood, your problem is quite advanced. And chelation was used in World War II when Navy sailors were painting ships. They became exposed to a great deal of lead, and in the process of removing the lead from their bodies through IV chelation, they discovered that some of the sailors who had heart disease were improving. And so that was the beginning of using IV chelation for heart disease. At one point, reportedly, it was covered by insurance, and then cardiac stents and open heart surgery progressed greatly, and that became the standard of care, and IV chelation fell into disfavor to the point that clinics that were offering it were regarded as quacks and disparaged. A few years ago, a Harvard-trained cardiologist was hired by the NIH to prove that IV chelation did not work for heart disease, even though it had been around for more than 50 years and patients kept seeking it out. And so his mission was to prove that IV chelation did not work for heart disease. His name is Dr. Gervasio, Gervasio Lamas, Lamas. And I encourage you to look him up on YouTube. He's got some great presentations, especially a PowerPoint presentation, and that's the one you want to look for. But anyway, he proved just the opposite. IV chelation is extremely helpful at improving heart problems, including atrial fibrillation. And you can see a lot of testimonials on our website. We even have a cardiac cath report on a gentleman who had a heart attack at 45, and he had 3-vessel heart disease. He's a dentist who's a good friend of mine, Dr. Robert Harris, an excellent biological dentist. And at roughly 70 years old, his heart started speeding up. He has a condition called Wolff-Parkinson-White. It was going, 200, 300 beats per minute. So he went to the same emergency department where he was first treated for his heart attack at age 45, and now he's 70. They controlled his heart rate, and they said, gee, you had a heart attack before, we're gonna do a cardiac cath and check out your heart. And what they found was that his arteries were wide open with irregularities, but no actual blockage. And when he was 45, he had a blockage of 75 to 95% or more. And at the time, they weren't doing stents. So what he did was seek out other ways to help himself, and he did a lot of IV chelation and IV Plaque-X. Plaque-X is phosphatidylcholine. It works much more effectively when administered IV, but there are phosphatidylcholine oral products out there. And as the name implies, it helps remove soft plaque from your blood vessels. It's also very good at lowering cholesterol, and it's very good for fatty liver disease. And you can learn a lot about IV Plaque-X at www.plaquex.com. So plaquex.com. And I would encourage you to learn about Plaque-X and IV Plaque-X and IV chelation if you have any concerns about your heart. I think anybody who's 50 and older, certainly anybody who has risk factors like diabetes and heart disease, should screen themselves for heart disease by getting a calcium score of your heart, which is a 5-minute CAT scan, no contrast, that looks for plaque in the arteries in your heart. And if you do have a high calcium score, then you know that you need to see a cardiologist and find a clinic that does IV chelation. But back to Dr. Lamas, his research was exceptional. He had over 1,000 patients, I believe, and what he proved was that folks who do not have diabetes and do 40 chelations and are on a vitamin regimen reduce their chances of dying from a heart attack, stroke, and all causes by up to 20% for the next 5 years after they complete the series of 40 chelations. But the research got even better, because in diabetics, doing that regimen reduces the chances of all causes of death, including heart attack and stroke, by up to 40%. So there's nothing in natural or conventional medicine that is as effective at reducing your risk. And we've had countless patients who had chest pain or shortness of breath, and they couldn't walk more than 10 or 20 feet. And after they do 5 or 10 chelations, they can tell that they're getting better and that they're getting better blood flow to their heart or their brain or their legs in the case of peripheral artery disease and claudication. So we encourage you to investigate this and share this video with your family. Again, on our website, there's a great deal of information about everything that we've covered. There's wonderful video testimonials, and there's a cardiac cath report from Dr. Robert Harris, who I mentioned earlier. So next we're going to talk about prolotherapy, prolozone, platelet-rich plasma, bone marrow aspirated stem cells, and umbilical cord Wharton's jelly stem cells for musculoskeletal problems like tendinitis, arthritis, and even ligament tears and muscle tears. So prolotherapy and prolozone are the foundation and entry-level injections in regenerative medicine. Prolo meaning to proliferate or grow, and there's prolotherapy and followed by prolozone. Prolotherapy consists of B vitamins, a little bit of glucose or sugar, and lidocaine. And we usually use prolotherapy and prolozone in patients with mild to moderate arthritis or tendinitis. If your condition is more severe, we tend to like to use platelet-rich plasma or some of the other modalities I mentioned, and we'll discuss each one individually. Prolozone is oxygen with a third atom. It's literally a gas, And through different mechanisms, and the lights are going off, sorry about that. Through different mechanisms, they help regenerate new tissue. But prolotherapy and prolozone are not quite as powerful, and typically you need 3 to 4 injections 1 month apart. When your condition is more severe or you want a better result, then we use platelet-rich plasma, which is from your blood, and we concentrate your platelets, which are rich in growth factors, and we can inject that into an arthritic joint, ligament or tendon, or muscle, and we get regeneration of the tissue. Again, if the condition is even more severe, then we tend to want to use amniotic fluid growth factors, amniotic membrane, and ultimately bone marrow aspirated stem cells from your bone marrow, or mesenchymal stem cells from Wharton's jelly umbilical cords. And of course, those are sourced from healthy moms, healthy babies, and they're tested as thoroughly as blood products. And these companies always pick young, healthy mothers and test their product thoroughly, because it would be very harmful to their reputation, as you can imagine. So when we harvest stem cells from bone marrow, we get roughly 50 to 100,000 stem cells that are the age of the patient. So bone marrow aspirated stem cells work well even in older patients, and we've done that for patients who didn't want a blood product, umbilical cord, Wharton's jelly, or amniotic growth factor from another human being. Even in a 75-year-old person with bad knees, we've taken that approach. In fact, a local chiropractor had me inject both of his knees, and he was having a horrible time working and even walking 20 paces, and now he can walk for 2 to 4 miles pain-free. Having said that, again, you only get 50 to 100,000 mesenchymal stem cells when you use bone marrow aspiration. When you go to commercial labs, you can get the equivalent of 1 million to 25 million. And they're newborn. These products come from newborn umbilical cords, and so they're very powerful at regenerating new tissue. And we use those in more advanced cases of severe arthritis or ligament tears. Now, your ligament tear can't be too big. It needs to be under a half a centimeter if we're going to have a chance at healing that. And when we're doing PRP, amniotic growth factors, umbilical cord, Wharton's jelly stem cells, or bone marrow stem cells, we always use prolotherapy and prolozone, because through different mechanisms, they're going to help you get a better result. And the best is 3 injections 3 months apart. There's nothing wrong with starting with the less expensive prolotherapy, prolozone. And again, we like to do 3 or 4 of those. And sometimes you don't respond to the first one, and that shouldn't discourage you. About 10% of patients don't respond, but they later on do respond and are very happy. And once you're numbed up, and we make it as painless as possible, it is a little bit uncomfortable, we're able to tap the bone and the cartilage, ligaments, and that micro trauma with the needle stimulates your body to heal itself. And we've had countless patients who, were told that they needed surgery, and they in fact were able to postpone surgery for many, many years. On average, anywhere from 3 to 15 years. My stepmother has severe rheumatoid arthritis for the last 40 years, and anybody with rheumatoid arthritis is more difficult to treat. And she had her right knee replaced, but she was an avid tennis player, playing 5 times a week. They were going to replace her left knee, and we treated her with platelet-rich plasma, and she did great for 1.5 years, but she continued to play tennis 5 times a week, so she chewed up through the PRP, and then we did aspirated stem cells on her, and now she's 75, so 10 years later, and the only joint in her body, because she has very advanced severe rheumatoid arthritis, is the knee that was injected with aspirated mesenchymal stem cells. So, that's a pretty good track record, because with knee replacements, they sometimes only last 5, 10, 15 years. So if you're, young, and by young I mean younger than 60, you want to do everything in your power to take care of these problems without having to have surgery. Surgery is great when you absolutely need it, and it works the majority of the time, but there is a respectable risk of blood clots and infections, and then having to redo the surgery. And then of course the rehab is quite prolonged. We can inject you on Monday and most people can go back to work the next day or the day after. If you'd like more information, we encourage you to go to our website, www.regenmedky.com, regenmedky.com. If you'd like to schedule a consultation, call 812-913-4416. The other service that we offer that's related to this is Ginvisc hyaluronic acid gel injections for osteoarthritis of the knees. Fortunately, most insurances cover this service and Medicare covers this service. The other regenerative medicine injections that we talked about are not covered by insurance. And so if you have arthritic knees, the gel injection is a very good approach to consider. We typically inject you once a week for 3 to 5 weeks. And you're basically creating more lubrication and cushioning, and there is synergy in doing these injections close together once a week or every 2 weeks. And we use fluoroscopic or ultrasound guidance, so we always know where the needle is. If your doctor ever does this kind of injection, 1 in 3 times that he injects, he will miss. And there's research data to prove it, and the orthopedic surgeon that trained me proved that he would never do that. He always said use ultrasound or fluoroscopy, because no matter how good you think you are, you're going to miss 33% of the time. So we take that admonition and recommendation very seriously, and I think that's part of why we get very good results. We also have a knee decompression device to improve the spacing of the knee, and we have an excellent physical therapist that also is very helpful to our patients. So I hope you found that information useful, and reach out to us through our website or by phone, and we'll look forward to meeting you. Thank you. Next, we're going to talk about hormone replacement in women. Hormone replacement in women is one of the most powerful anti-aging tools. We prefer bioidentical hormones made from plants because they're chemically and structurally very similar to what your body produces. And I neglected to introduce myself. My name is Dr. Raphael Cruz, MD, from Kentuckiana Integrative Medicine, and we're talking about hormone replacement in women. So again, it's one of the most important strategies from an anti-aging standpoint. It's helpful for a myriad of symptoms, not just menopausal symptoms. And one of the main questions women will ask is, when should I have my hormone levels checked? If you feel that you're perimenopausal or menopausal, meaning you're having fewer periods or you're no longer having periods, that's a good time to check your hormone levels. But you can't just consider lab data. You need to consider your symptom profile. So you want to ask yourself questions like, am I having hot flashes? Am I more irritable? Am I having vaginal dryness or vaginal pain? Am I having less stamina, poor concentration, less interest in work or the activities that I used to enjoy? Am I having more stress and incontinence? So those are all symptoms of menopause, and that should prompt you to get testing. Another frequently asked question is, how much does hormone replacement cost, and does insurance cover it? Insurance rarely, if ever, covers hormone replacement. And the cost at Kentuckiana Integrative Medicine is a $300 consultation, and we give you a prescription for lab work, and we hope that your insurance will cover that. Most of the time they do. And then it's $2,400 for the year to manage your hormones and adjust the medications appropriately, as well as your thyroid levels and medications should you end up with low thyroid. And when you do check your hormone levels, you should check, do a complete workup, meaning a complete blood count, a complete metabolic profile, lipid profile, hemoglobin A1C. If you're having a lot of fatigue, you want to check some antibody levels of viruses, and of course your testosterone, progesterone, and estrogen. And ladies are more complicated than men. Some ladies can do very well with just testosterone replacement with one injection every 1 to 2 weeks, or testosterone pellets. Other ladies prefer the creams, or a mixture of creams and oral medications. Progesterone orally is often given for anxiety and sleeplessness, and a lot of women like that. And other women prefer to combine their testosterone in a cream with your estrogen and progesterone. It's very important that you use bioidentical hormones. The pharmaceutical prescriptions are mostly made from horse urine, and they're 50 to 100 times more powerful than what your body's used to, and that's why there's a higher incidence of blood clots and cancer. Bioidentical hormones, have a much lower incidence of causing cancer, but the risk is there, and that's why we ask you to be, thoroughly checked by your OBGYN with a pap smear, pelvic ultrasound, and mammogram or thermogram. So we are very judicious in adjusting your medications. We get input from compounding pharmacists who are very skilled in this area when there's an occasional difficult case, and we get very good results. So if you're interested in making an appointment, call us at 812-913-4416, 812-913-4416, or contact us through our website, where there's a lot more information, www.regenmedky.com. That's regenmedky.com, regenmedky.com. Thanks for listening, and we'll look forward to meeting you. Next, I want to talk about sexual wellness and health and stress incontinence. Both men and women can struggle with sexual dysfunction. We are very successful at treating that at Kentuckiana Integrative Medicine with platelet-rich plasma injections or umbilical cord Wharton's jelly mesenchymal stem cell products. And men sometimes suffer from erectile dysfunction, and when we use these injections, which are nearly painless, we improve the circulation to the penis, and we can often improve the firmness of the erection and the sensitivity of the penis, so that intimacy becomes more satisfying. We have been able to help with stress incontinence in men. And in women, sometimes when they're menopausal, they develop vaginal pain, vaginal dryness, and sometimes the hormone replacement isn't enough. So we can inject ladies' privates nearly painlessly and improve their sexual function and satisfaction. We can relieve vaginal pain and dryness. We can correct stress incontinence. The most powerful example I can give is a gentleman who had his prostate removed roughly at 55 years old for prostate cancer. And from then on, to have intimacy with his wife, he had to inject his penis with a medication called Trimix. And we prescribe that medication also. And he wanted regenerative injections like the P shot. The penile shot is the one for men, and the O shot or vaginal shot is the one for women. And this gentleman was having profound erectile dysfunction for 10 years and stress incontinence, because when he had his prostate removed, the nerves were inadvertently cut that provide an erection. So he, because of the severity of his case, we used umbilical cord Wharton's jelly mesenchymal stem cell product. And 3 weeks after his first injection, and he committed to 3, 1 month apart or 3 weeks apart, and that's really the best approach. within 3 weeks of his first injection, he was having morning erections, but a lot of men, after age 40 are not having those, unfortunately. But he recovered them after not having them for 10 years. And within 3 weeks, he started having spontaneous intimacy with his wife, and he was thrilled. But even better, or not better, but in addition, he was having dribbling when he would urinate, and he would lose his urine with coughing. If he fell asleep and had drank a few beers, he would have a little bit of a urinary accident. And after this injection, his stress incontinence resolved. So it's a wonderful therapy, and if you're having those issues, we encourage you to look at our website and contact us through our website. The website's regenmedky.com, regenmedky.com. Again, regenmedky.com. And our phone number is 812-913-4416. Thanks, and we'll look forward to meeting you.